Most common side effect of a GLP-1 is nausea by far. Somewhere between 40 and 45% of patients experience nausea at some point on the medication. The nausea comes from the slowed output from your stomach. So if you can picture eating a taco, pre-GLP-1, it would be super weird for me to start a taco and not finish a taco, right? It's a defined amount of food. Post-GLP-1, if you have 5 or 6 bites of a taco and you feel full, you stop eating the taco. One is because you have that full feeling, right? Your brain is kind of working on that feedback pathway saying, oh, I don't need to eat anymore. But two, if you continue to eat past that full feeling on a GLP-1, your stomach's not emptying very quickly. You're just putting more food on top of an already full stomach that's emptying slowly. You're going to be nauseous. At Tyde, we really try to make sure that patients understand that process and understand why it happens to minimize the chances of nausea. But ultimately, if you are nauseous, we have lots of tips and tricks to help overcome the nausea or prevent it altogether. And then ultimately, if we need to treat the nausea using medication temporarily, we will. The good thing about nausea with the GLP-1 is that it's temporary. It usually happens when you first start taking the medication. And then when you go up in dose, some people experience nausea. But like I said, usually temporary, usually passes as your body adjusts to the medication. And frankly, as you adjust to being on the medication as well.